Greetings and welcome to Caregiving Over Coffee, a live telephone and web education program. Thank you and hello, everyone. On behalf of the Leukemia and Lymphoma Society, I'd like to welcome you all to our telephone and web education program, Caregiving Over Coffee, an interactive Q&A. Dr. Applebaum had an emergency, and Dr. Mitchell, who has been working closely with Dr. Applebaum at Memorial Sloan Kettering Cancer Center, has graciously volunteered her time today to speak with us about caregiving. I'm Lizette Figueroa, Senior Director of Education and Support here at LLS, and I'm excited to be with everyone today. We're grateful to have over 300 people participating today. Now, LLS is funding the critical research necessary to advance cancer cures. As the leading source of free blood cancer information, education, and support for patients, survivors, families, and healthcare professionals, LLS helps navigate you or your loved one's cancer treatment and works to ensure that you'll have access to quality, affordable, and coordinated care. We know that caregivers and patients need help before, during, and after a cancer diagnosis and during treatment. Caregiving is challenging, and LLS is here for you. As a caregiver, we really do want to be there for you, and we ask you to please continue to inform us of what you need during this time. I'd like to thank Pharmacyclics, an AbbVie company, and Biotech, and Janssen Biotech for support of this program. I'm now privileged to turn the program over to Hannah Rose Mitchell, PhD, MPH, the Chief Postdoctoral Research Fellow, Department of Psychiatry and Behavioral Sciences at Memorial Sloan Kettering Cancer Center in New York, New York. Dr. Mitchell, I'm proud to turn the program over to you.
Thank you so much for the introduction, and I am so pleased to be here as well. I'm so glad that we're recognizing the magnitude of importance of cancer caregiving, an issue that it is at Memorial Sloan Kettering, where I have been working very closely with Dr. Applebaum. We have really prioritized in recent years, but there's so much work to be done in terms of prioritizing and recognizing the experiences of caregivers, and I'm so happy to have this support to present today. So we can move to the next slide. Yes. So I like to start my talks with a quote that Dr. Applebaum also uses, and it is by the former First Lady Rosalind Carter, and it's that there are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. And it really emphasizes the way in which the caregiver role weaves throughout the lifespan, and that we all tend to be caregivers in so many ways. And I in all of my work, and I think what we've done a good job recognizing here at Memorial, is that cancer impacts not just the patient, but the entire family. Cancer is a family problem, and it is absolutely essential to treat not just patients, but family and friends as the unit of care. So we are really trying to increase this recognition of the toll of cancer on the family and empower caregivers to cope with what is often the most difficult periods of their lives. So I'm so glad that we have so many in attendance today who are prioritizing their own self-care and recognizing how serious it is to be a caregiver. In this definition here from the National Cancer Institute, you'll see that included in cancer survivors, the definition of cancer survivors by the National Cancer Institute are family members, friends, and caregivers, that they are considered part of the survivorship experience themselves. So I think that it really emphasizes that cancer caregivers are all of you. They are so many among us, and that they are cancer survivors as well. So similarly, like, what does it actually mean? What does caregiving involve? And I think a lot of people, sometimes might not even call themselves a caregiver based on the things that they are doing that might seem sort of second nature or seem like just what would be expected to do. So it's really anyone who's providing what is often unpaid emotional, instrumental information, or financial support. And I'll reflect briefly on what those might mean. But we have seen this major shift in the healthcare system that has required so much care to be provided in the outpatient settings and in the home settings. So what certain actual, like literal care tasks that I'm sure many people are engaged in here that may in the past have been designated for skilled nursing personnel are now tasks that the family is required to take on. So many people are caregiving, and that much of the world is dependent on care from others. And, if we can, I like to say that we have, there are 19 million cancers diagnosed in 2020. And let's assume that each one of those people has at least one caregiver, because it's kind of what's often expected. We have more than 20 million people caregiving at any given point in time. Caregivers tend to be female. They tend to be providing care to adult parents, and many caregivers provide care for more than one person. And we'll talk a little bit about that today too, as I believe. And caregivers on average, a study by one of my former mentors found that caregivers provided on average 8 hours of care per day. But I think we'll talk about what that definition looks like too. Providing care for around 13 months on average, and with many caregivers providing care for more than 5 years. And as was mentioned earlier, the caregiver role is something that goes on, and that it's not limited to one specific point in time. And so we mentioned the activity or the different types of support that are provided. So when I say instrumental support, this is provision of assistance with day-to-day problems, the things that you need to do to sort of get through the day, the practical assistance, what we refer to as activities of daily living. This also might involve actual skilled nursing tasks, as I referred to before. Then there's the emotional support. There's the being empathic, being sympathetic, being this person to talk to, being the person to listen without judgment. It's so integral to the patient's overall care, and it places a burden on the caregiver, which we'll talk a little bit as well. Informational support. This can be researching information about the latest treatments, finding services for the patient, connecting the patient with what it is that they may need. Financial support. I think that one's pretty straightforward, and that's there are many out-of-pocket costs for cancer caregivers. And what this shows here is the notion that while some cancer caregivers report having received some sort of preparation for the medical and nursing tasks that I mentioned that they're involved in, many are doing so without preparation. More than 4 in 10 are preparing these very complex tasks without any prior preparation, which I think, as many of you know, is extremely scary and stressful. And we'll talk about this concept of caregiver strain or burden. And the burden or strain results when what you're being asked to do in your caregiver role, those demands kind of exceed what it is that you have to give. I would imagine that many caregivers on this call are feeling restricted, and as though they only have so many hours in the day, they only have so many tools, they only have so much knowledge, they have other people to care for, they have jobs, feeling restricted in many other ways. And when you're being asked to do more than what you really have the resources to give, that's when you experience strain or burden. And burden we like to view as this sort of multidimensional construct. So yeah, if we click through this, we can see sort of what comes up. So first, there's a psychological burden. Caregivers experience anxiety, depression, mental health problems. Some even present with post-traumatic stress. Some may even have thoughts that life is not worth living. And then the physical we have here, so the pain that caregivers may experience from the actually physically demanding tasks, or from having inflammation in their body because of stress. The impact on their sleep tends to be very impacted. And I think we'll probably talk about that more today. Their immune functioning. So if you're feeling really stressed, you may feel more likely to develop the common cold, for example, and that's an impact of the strain and stress of caregiving. Health behaviors tend to be impacted, so maybe not keeping up with the diet and exercise that has been ideal in the past, or unhealthy habits like tobacco use or alcohol use. Socially, yeah. So a lot of caregivers report isolation, having relationship conflict, whether that's with the patient or with others in their life due to their overwhelming circumstances. And then these like role changes, like socially, that suddenly you're required to, maybe spend less time socializing with certain people. COVID has really impacted that too. Spiritually, so sort of the existential threat that comes with a cancer diagnosis, the word cancer itself sort of has us confront our spirituality, and people's belief systems might feel really challenged when they're required to go through this horrific experience. And next we have the financial burden. This is the changes in employment status because of the caregiver role, taking on the caregiver role, the treatment costs, the many out-of-pocket treatment costs that caregivers are required. And then finally, temporal. So this means like the time that's spent actually caregiving. The demand is so large. And that's time that's often taken from other responsibilities or activities. I think in the Q&A, we'll really have the opportunity to talk a little bit more about strategies for self-care. Like, what is it that we do, right? I sort of want to offer support, but just in summary, briefly here, I want to talk about like some key points, which is that just describe the burden, and now that you are aware of the sense that this burden is so common in cancer caregivers, look for the signs and symptoms of burden. Are you feeling strained? Do you feel like maybe you don't have the resources to keep up with the demands? And if that's your experience, there's a very good chance that you're experiencing caregiver strain, and that you are in a position where it's important to access support, whether that's self-care or looking to your social support network. Asking for help is so difficult for anyone, especially caregivers. I find that caregivers with whom I work here in our caregivers clinic at Memorial tend to report prioritizing the patient so much that it can be really challenging to ask for support for yourself during this time when your world and maybe others in your family's world surrounds the patient. But challenge yourself to ask for help. Look for unlikely sources of support. Sometimes our typical support system can be really difficult to activate during this caregiving experience. Certainly professional sources of care, and I'll provide a brief list of those later, but yeah, I mean, the fact that you're all here today is a first step in that. I think that's incredible. And there's other sources in the community like Cancer Care. There's the National Association on Caregiving and resources that, and considering going to a licensed social worker or psychologist or someone who can provide you one-on-one support. And just briefly, I'll be very happy to talk about more specific strategies for self-care in the Q&A, because I think those types of questions will come up. But I just want to say that when it comes to self-care, guilt is a huge red flag, right? So if you're feeling like I shouldn't be taking time for myself, that's a thought that I encourage folks to look out for, to kind of catch yourself saying I shouldn't be doing this, and that there's probably a need there. There's a need to take care of yourself. And that can include expressing emotions like that, reaching out to your support network, or doing what it is that makes you feel well and makes you feel best and whole. I think that I'll just finally emphasize there that the caregivers are a critical member of the treatment team. And if you're unable to take care of yourself, it's going to be very difficult to take care of the patient. So encouraging you all, and again, emphasizing how valuable it is that you all came here today and are looking to gain resources. So that's kind of what I have for this portion. I really am excited that we have had, I think many questions came in, and we'll transition into this Q&A phase. But I'm excited to sort of really address what's coming up for the folks who are in this room. I do want to just briefly thank the caregivers who I work with for providing me so much insight and knowledge and vulnerability. And then of course, my mentor, Dr. Applebaum, who was very upset that she couldn't be here today, but for providing content for today's talk and these slides as well.
Thank you so much, Dr. Mitchell, for the presentation. For the folks on the line, it's time for our question and answer portion of this program. For everyone's benefit, if you can please keep your questions general in nature without many personal details, so Dr. Mitchell can provide answers that are really general in nature. We will not be addressing specific disease or treatment questions during this program. Now, to ask a question, please click onto the Q&A button on the bottom of your screen. So, Dr. Mitchell, our initial question today, the person states, I'm not just a caregiver. I have multiple roles, as many of us do. Can you please address ideas for self-care along with the challenge and meaningful moments, one juggling while balancing multiple roles? I'm a psychologist, a care partner, a support group leader, volunteer, and more.
Yeah. This is a poignant first question. There's a lot of research on what we call role strain, which refers to this idea of sort of juggling multiple roles that caregivers are suddenly jolted into, often without preparation. We tend to see role strain often in women a lot, who are traditionally expected on to take on multiple caregiver roles, or parents who are providing both childcare, but also just in anyone who has other, other parts of themselves that are not just limited to their caregiver identity. So one thing I'd like to pull from this question is the idea of looking for meaning or meaningful moments. And I think that it's insightful to think about looking for sources of meaning in the caregiver experience, and that often can be really challenging to recognize, because caregiving involves so much suffering, that there's all these existential concerns. There's feeling overwhelmed, as was so clearly pointed out in this question, and that can also sort of be linked to disconnecting from other parts of your identity. But that type of suffering doesn't really preclude you from experiencing, or doesn't fully, right? Like, so make it really challenging, but it doesn't fully stop you from experiencing other positive emotions or growth or connecting with sources of meaning. So looking for ways around you to find like what it is that you value, what it is that makes you feel connected, and thinking really, really small. And I work with a lot of caregivers who report that providing care to a loved one in itself can have some value and meaning. For example, I work with a caregiver right now who talks about the way that she has being a caregiver as part of her identity in a really positive way, that she's provided care for multiple people throughout her life, and she's modeling that for her daughter. So, we encourage having empathy and compassion for yourself, and looking for these sources of meaning in everyday things.
Sure, thank you so much. And the next question, Doctor, I'm on disability for a very expensive condition and taking care of our chronically ill child. My husband, who's supporting us, was diagnosed with lymphoma last year. On our first visit to the oncologist, I was given a packet for the caregiver. How am I automatically assumed to be the caregiver for him when I'm already a caregiver for myself and our child?
Yeah, I think, wow, that's a great question. It really reflects how loaded the word caregiver can be. And I kind of touched on that in our presentation. And a lot of people might really not call themselves or consider themselves caregivers. And, I sort of defined the caregiver quite broadly. It can be any family or friend who is somehow involved. I also think that, what is highlighted here in this question is that there's this big onus that's getting put on the caregiver or so-called caregiver, this family member, that suddenly, like, you might be expected to do these sort of like skilled nursing tasks. And I want to recognize that it's a sort of a societal problem that we face, and systemically it's an issue that we're working to advocate for support for caregivers and things like that. But in the meantime, it's not really fair that you're in this role. And while in this role, you must be taking care of yourself too. It sounds like you have your own health concerns, and I'm going to probably use the phrase self-care many, many times today, but this is taking care of yourself first so that you can adequately take care of the patient is so integral.
Thank you. And the next question, my husband is keeping his diagnosis a secret for various reasons, including professional.
Yeah.
This makes it harder for me to ask for help and also explain why we are so careful about COVID. Any
Mhm.
ideas?
This is a tough, and it comes up a lot, right? Because it sort of stifles the way in which the caregiver is able to communicate. Um, yeah, and sometimes the language that we use might feel like really restricted by what the patient even wants or the patient wants to hear. My suggestion is for this caregiver specifically, or just any caregiver who feels as though that they feel somewhat restricted by the patient's wishes and concerns, even if you feel like it's really valid or are kind of on the same page about it, is to seek out sources of support for yourself, where you are able to disclose some of the experiences that you are feeling or feelings that you're having. Certainly, it does create a challenge with COVID-related concerns, but I think it's perfectly valid to take very extreme precautions for COVID at any stage or for anyone right now, and that that it might feel really uncomfortable, and some of the challenge might be like in sitting with the discomfort around setting boundaries with others, or choosing not to disclose and still having that communication say we can't do something because of the pandemic and everyone else seems like they're doing it. But look, challenge yourself there. What's the thought that's coming up? Do you think that they're that they might not like you anymore, or how is that going to impact your relationship? And it might be worthwhile to sort of look at what's coming up for you, and the thought that you're having, and what might be another helpful way to think about it, because it sounds like you're doing everything you can to sort of protect your family.
Yeah, and continuing really on the self-care, can you suggest additional coping mechanisms for the emotional roller coaster that we experience as caregivers? I exercise, eat a healthy diet, get enough sleep, have a social network, but still struggle with the emotional response to my husband's multiple myeloma, heart failure, and type 2 diabetes.
Yeah. Well, first I want to provide feedback that it's so incredible that you are doing all those things, because it's so challenging while in the caregiver role and while experiencing distress. And emotional roller coaster is a really poignant way to put it. That there are so many ups and downs throughout the caregiver experience, and I think that Lizette sort of reflected on that at the beginning, talking about all the different stages of treatment in which and beyond, in which the caregiver distress is evident. And I think that looking for ways to take care of yourself spiritually and emotionally during this time is going to be really important too. So it might require confronting the question of what that really means for you, whether that's accessing different sources of support in your life, finding professional support to sort of talk about those emotions, journaling for some people, and really using the resources around you that are really dedicated for emotional wellness. I think that what I really liked about that question was that it captures how comprehensive it is, and that we can do things for our physical health that should ideally help our emotional health too. But caregiving also comes with a range of really distressing experiences, and then it's quite not uncommon to have those emotions you're describing.
Right. And what do you do with the person you're caring for that is extremely depressed but not willing to see a professional?
This is tough too, and it ultimately has to come from the person themselves, right? So the loved one who is feeling that way that's ultimately their call, and having respect around that is key. And what I think is most useful, and kind of like the most important thing you can do, is sort of express how you feel. So what it is that, using sort of I statements, like I feel in whatever situation, that this particular emotion, in order to express to the patient or your loved ones, just sort of like the impact on you too. And perhaps that may encourage them. Of course, everybody's very different. I don't know about this particular loved one, but I would say broadly, my feedback is to enhance communication, speaking from oneself, right? Like using that sort of so expressing your own feelings.
Right. And the next question, how do I give my young adult support, but also space, right? I want to be there for every visit, but not make her feel like I don't think that she can do certain things on her own.
Yeah, I think that's really similar. And what's key here, and when we talk about anyone who in this room who's caring for young adults, adolescents, developmentally experiencing cancer during that time is so particularly challenging. It comes in a way that's highly unexpected, and they often will feel very isolated and disconnected from same aged peers, and those are challenging conversations for them to have. And I think as a parent or a caregiver of a young adult, it can be really important to have an open line of communication while acknowledging their independence. Like the fact that you're asking that question, I think is indicative of a really healthy attitude and awareness of your loved ones' autonomy, and that they're at a stage where they're transitioning into independence, and that you want to help them foster that. You want to kind of mentor them and help them, provide them, show them that you're there for them, to provide them the resources and tools that you can, and recognize or provide, even like let them know, like, hey, I think you're doing a really good job with this, and I see that you're doing that on your own, and might empower them a little bit in their independence.
Sure. And someone is asking, is there an elevator statement that can be used for those who do not understand how caretaking is completely consuming in all ways? The person is thinking of those who want some of your time when there's no reserve left to give anymore.
Yeah, so I'll respond in sort of two ways. So one is that I think it's important for that to sort of come from you, right? So how is caregiving impacting you, and in what meaningful ways that has? So I love the idea of writing out sort of an elevator pitch, what it is that you're going to tell. And a question I often get will also be from people who just are like, people ask me, how can I help? Or what it is, may not really know how, like the right feedback to give, or feedback that they feel comfortable with. I also, let's take some of the things that like I shared earlier and integrate that into your elevator pitch. So saying something like, or statement, I should say, but saying something along the lines of, I'm required to give around the clock care, or, we are coping with cancer together as a family. And, sharing that you're part of the unit of care, and that's recognized by science and the healthcare system, right? So that the patient and the family are the unit of care, and saying we're coping with cancer together, and that's taken a big toll on us as a family and taking a lot of our resources.
Right. And the next question, I often do not speak at meetings my wife has with her cancer doctor. I occasionally ask questions. However, we've not been assertive enough about side effects and the pain they cause. How assertive can we be while we're in that doctor's office?
This is a wonderful question. So I, working in multiple health systems, one thing I've seen consistently is that patient and family caregivers are your own best advocates. So yes, being assertive is incredibly important, as I think you recognize in that question. I think you need to be as assertive as you can, and you feel comfortable and as much as possible. And practice being assertive. Maybe that might involve you and a friend, or you and your loved one literally role playing what conversations are going to look like with providers, because it can be so tough to get your questions answered. In communication skills, we encourage our patients to sort of like have plans before meetings. So you might, like I said, you might want to be on the same page as your loved one. So you maybe say something like, would it be okay with you if I asked the doctor what we may expect from this treatment, or what the side effects or pain might be? Come in with lists of questions, take notes, because if it's so key, and I think you're onto something with this question, to have these conversations, because if the questions don't come up, or you feel like you're not being assertive enough, sort of result in this sort of continued cycle and network of silence between everyone, that it's important to sort of break and get in there and really advocate for yourself.
Sure. And how about those folks that actually the patient does not want them to be in those meetings, or even a caregiver that's a long distance caregiver that may not physically be in those meetings?
Yeah. So this is key too. And sometimes we have like in family systems can be really complicated. So there's like one person who wants to be in the meeting, or one person who doesn't, or one person who's sort of taking on the advocate role. This is where like we really encourage communication, and just I know all families are different, so this advice, one size doesn't fit all. And I think that open lines of communication are so important during this critical period, and that it's fundamental to the patient's care, really, and that it's important to be on the same page in terms of prognostic understanding of the illness, what you expect around treatments and side effects. So having conversations about what people's roles are, I think, and recognizing that if there's anything from the brief talk I gave, is just like all the different types of roles that caregivers provide. So, some people might define their role a little bit differently, or step up and do something a little bit different for the patient. And that might be a way to sort of like build on different folks' strengths. Another like element of that question I just want to make sure I get at is sort of like, if the patient doesn't really, I think that's what you're asking, like if the patient doesn't really, want the caregiver. And again, I think that that's important, and you have to value that and recognize the role of the caregiver as part of this unit of care, and having conversations with the patient in advance, to see as you can be on the same page as much as possible. If anything, sort of express your concerns in a way that can get integrated into the questions that the patient then asks. So you empower the patient to ask questions on behalf of you as a team, and sharing with those I statements what it is that you are feeling and how the caregiving is impacting you.
Yeah, I think that's really good tip for caregivers, that if your loved one, the patient, does not want you to be a part of it, to still have that communication, so the patient can get some of those questions answered, for both of you. I think that's really important.
The whole family, yeah.
Yeah. The next question. So how do I stop worrying all the time that the one I love the most won't make it, and that our future is very much in doubt? How do I deal with feelings of resentment about our life being tied to my husband's health needs? And what you were speaking about earlier, Dr. Mitchell, the guilt and resentment that it breeds.
Okay. Yeah, and you're reflecting here on sort of that existential crisis that comes up with caregiving, the uncertainty about the future. Uncertainty, challenges, handling and facing uncertainty can lead to anxiety. So we know that this can actually result in sort of like a clinical psychological symptom, and that the worries sort of sound like anxiety here. And I think this is just to sort of piggyback off of what we were just saying. I think this is also a place where communication can be really helpful. And also, while I do recognize like every patient caregiver relationship is distinct, some caregivers and patients it's the closest person in your life. Others, it might absolutely not be the case. But we do know it's effective to share your experiences and feelings with your loved one, and that can bring you closer. And they also might be experiencing similar worries that they may be hesitant to express for multiple reasons, in part to even shield the caregiver. So the open lines of communication about that can be really key. I mean, I'll make a pitch also here for mental health services and, to cope with some of those worries that you're having. Guilt. So I think guilt is a really common experience. I mentioned it earlier. It's a big thing that comes up, but I think if you're experiencing that guilt, it might be a sign that there's a need to take care of yourself. It's okay to feel as though, you're feel frustrated that your own self-care has been placed to the side. This is like where I introduced the putting your oxygen mask on yourself before you can put it on someone else's face metaphor, that you need to be able to breathe in order to take care of someone else. So really setting aside time for yourself can be actually really instrumental in the patient's care. And sometimes that requires just sort of a shift in your mindset, what I can do for myself to best care for my loved one, to be fully present in those moments that we have together in a way that maybe I don't resent them as much, that taking that little going and getting a manicure or going for a walk or something that, making yourself a snack that you really enjoy, or something even small, but that you feel like is meaningful and important to you, can ultimately bolster your capacity to take care of the patient and to make meaning out of the moments that you do have with them.
Yeah, definitely. And the next question, how is caregiver fatigue treated? It is a real issue and can be a detriment to the cancer patient and survivor's health and well-being. And both caregivers and patients suffer when there's that caregiver fatigue.
Wow, yeah, that last point of the question really gets at the idea of how interrelated the patient and the caregiver are, and how the patients can suffer too if the caregiver is not at max capacity. So I think there are a couple of elements to this. So first, like I would introduce the oxygen mask metaphor again. Self-care with this. Like you have to set aside time for yourself in order to, to stay up to par for being able to take care of another one. And there are multiple reasons why you might be experiencing fatigue too. It could be from the physical demands of caregiving. I mentioned that people are literally doing manual labor, physical tasks of caregiving, also maybe being up really early for appointments, going all day, taking on other tasks. Like I worked with a caregiver who had to take on sort of all the landscaping and yard work that she had never done previously. So all of those things can be quite exhausting. Sleep can be really impacted, and I'll come back to that, but I also just want to say that like the stress response that we have in our body can result in fatigue. So when you have, earlier someone asked about the negative emotions, and that even though they were doing all these other things to take care of themselves, they still felt those negative emotions. Well, that can really wear and tear your physical health too, resulting in symptoms of fatigue. So if you have stress in your body, there's a physiological response. Cortisol levels are higher. There could be inflammation and things that make you feel physically fatigued. So this is a common problem, as you reflected. Self-care, number one. I also think looking at sleep, really doing an assessment. I think I know a lot of caregivers experience insomnia. We've seen I think 75% of caregivers, up to 75% of caregivers report symptoms of insomnia, which is I think the general population is more like a third. And for that, so do a little self-assessment of insomnia. Are you taking greater than 30 minutes to fall asleep every night? Are you waking up multiple times throughout the night, having difficulty falling back to sleep? Has that been going on for several months? And you might have full-blown insomnia. there's some resources. So the gold standard treatment for insomnia, they suggest anyone who can access it in their communities is cognitive behavioral therapy for insomnia. It can be really good to engage in this during your caregiving experience because it's insomnia is sort of a habit that lasts for a really long time. And to address it early on or change your sleep patterns early on can be key. To make it more accessible to everybody, there's an app, the cognitive behavior, or it's called CBTI Coach, and the VA actually created it, and it's free to download on anyone's phone or iPad or things like that. So if you feel like you could do an assessment of your insomnia on there. It also just gives tools for what we call sleep hygiene, so how to improve your sleep. So I took this question. Fatigue and sleep are separate issues technically, but I do think that, you could be reflecting the experience of many, many caregivers who have insomnia. So I wanted to spend a little time talking about options for sleep. So I recommend the CBTI Coach app, or finding anyone in your community who does cognitive behavioral therapy for insomnia, or just spending a little time researching it, and again, prioritizing your own sleep needs.
All right, thank you. I just wanted to point out that one of the caregivers on, she mentions that in caring for her aunt, because she's in another state, the aunt would call her during the appointments, and put her on speakerphone. And that's a way that she was able, as a long distance caregiver, to be a part of that conversation, and feel a part of that conversation.
And yes, I'm so grateful that caregivers shared that innovative solution to that. And I meant to say that earlier in the question about multiple family members throughout the country. Yes, we have telehealth now too. So many appointments might occur online, and to ask, please, I encourage everyone to ask, schedulers if there's ways to bring in multiple people or what that might look like. And certainly I love the speakerphone idea. I think that's innovative.
Yeah, it's definitely a great way. A lot of us don't live close to the people that we're providing care to. But as you said, technology is making us closer. So that's definitely a good way for our caregivers to be able to be a part of it. We do have a question, and this question was asked by multiple folks. They're asking, how do you deal with a patient who's very mean or non-communicative with you?
Yeah.
Like they share their frustration with you.
That comes up a lot. So first, know that you're not alone. I think that I'm really glad that you mentioned that multiple people experience that, because it can feel really tough. It's so challenging to be giving all of yourself for someone who may not express gratitude. And I reflected that earlier. I think some people have our relationships with our patients tend to really vary, and that they can be of different qualities. And caregiver stress, actually, the levels of caregiver stress that people experience has not been really linked to what the quality of the relationship looks like generally in the literature. So it doesn't mean that if you are closer with them or less close, or have more conflict, but conflict in itself can certainly be a cause of stress there. So I think that's worth taking a really good look at. In our clinic here, we have services for families and couples actually going through the caregiver experience to work on their relationship conflict and communication during that time. And if you have access to those sorts of resources, it might be a really worthwhile time to engage in that. I think one thing is just sort of having a lot of self-compassion. If you're not really getting it from the patient, how can it come from within? What is it that you'd like to hear, and what can you tell yourself? What are the positive self-statements that you can really tell yourself about how good of a job you're doing? Because I will say that every single one of you who are on this call is doing an incredible job as a caregiver, because you're here and you're prioritizing, your self-care, clearly invested in how you can improve the patient's care as well. So being really compassionate with yourself, because sometimes that's where we can access it most readily.
Right, giving yourself that grace. I think that's very important, as well as knowing that, a lot of times it's frustration and people are scared
Mhm,
and
mhm,
they are open enough to be scared with you as
mhm,
their caregiver, but sometimes people don't know how to um, really communicate that,
mhm.
right?
Yeah, yeah. And like I mentioned earlier, expressing your own, being really vulnerable with your own emotions sometimes can sort of model to your loved one what it is that might be useful and open up the sort of channels for more communication about the feelings that are occurring for everyone as a whole. We know that these sort of like interpersonal processes, the way that you talk about things and process them together, um, really matter to both the patient and caregiver, and it's a very, very interpersonal process.
Right. And I love how our caregivers are chiming in. Another caregiver also says that she memo records appointments on the phone so she can send it to all of her adult children. So that's another great idea for the other folks out there.
A wonderful strategy.
Yeah. So another caregiver for a child, how do you handle, or is there a need for concern when your child, who's also a patient, seems not to care about treatment as
Mhm,
much?
mhm.
Being a teenager, there's some understanding that there's also a desire to want to get better, um, but the child is not expressing interest in regards to treatment. So the parent really wants to know, is there anything that they can do to get the child to be more proactive, or is this something that's just transitional?
Yeah, I mean, I think this reminds me a little bit of the other question about a young adult. And I really want to emphasize that it's just really tough developmentally, that it's just such a difficult age to be experiencing this, and that it doesn't feel normative or like what any of your same age peers are going through. So there can be a big discrepancy between
Yeah.
the sense of urgency that the parent or caregiver is feeling and what the teenager in this case is feeling. So I think that with that you might want to look at that frustration that you might likely be having and take a good look at what that's telling you, which might be, related to how hard it is and how much concern you have about the patient, or in this case, your child. And look for strategies of even acceptance of their own attitude around it. Of course, well, it does really matter, and you want to have your healthcare team on board with the level of engagement they have, and things like adherence are really important, and those are really critical factors too, and like information and knowledge that they have as they go into survivorship stage, and have to think about things in the long run. But I think in the present moment it sounds like it's quite normative. It really does, and it sounds like I can recognize and appreciate the kind of frustration that a parent might have there, and or just concern, worries, and wanting to sort of see that reflected in someone else. But it could be okay. It could be a-okay that they're not experiencing the same kind of worries or concerns.
Thank you. The next question, we have so many doctor's visits, lab appointments, PT, OT, social workers, other treatments. We're always on the run. It's not easy to find the time to enjoy each other. So how can we get more out of life and make this time better?
Yeah. So, I mentioned the temporal demands of caregiving, and I think that goes for the patient as well. We're living just life, everyone's busy, and then to take on this incredible time consuming experience of cancer can be quite challenging. Um, you know, it's tough. I like to think about really starting small. Think about looking at all the really little things. It might look incredibly different. We tend to see that we're in this completely new normal, and things look so drastically different than the types of things that may have been, like a date night or whatever it was that in the past you did that allowed you to enjoy each other. This might have really changed, but in our meaning centered approaches here at MSK, we think about like finding access to sources of meaning in your life. That might be something you're able to do together, reflecting on memories, or finding humor in moments when you're stuck in the car together for a long time in traffic, or looking for enjoying a sunset that you may see. And it may sound silly, but there are, even in these times of suffering, there are these little moments around us that can bring pleasure and joy, and you can sort of engage in that process together. I also want to say that I think it's important to recognize that incredible love that you're showing through the act of caregiving, and that I hope that may in some ways bring you closer together. And a lot of caregivers do report feeling really empowered by that love, or that their relationship is strengthened by the caregiver experience.
Yes, we've also heard that too. Yeah. The next question, how do I prepare for the end stages of caregiving?
Yeah, so I think this sort of reflects what it is that was mentioned earlier regarding all the sort of timeline of caregiving. And your caregiving role, frankly, never really ends in a lot of ways, right? So even depending on what comes next, so if you're transitioning out of cancer care and like going back to your previous roles or freeing up time, it may feel really odd, and and that may feel really jarring. Of course, we can be talking here about bereavement, which is very relevant. And I think that around that, there are very, very unique concerns, like anticipating what your grief might look like. So I wanted to answer this question as broadly as much as possible, because the end stages can mean lots of different things, but I kind of want to give the feedback that it just simply doesn't end. And I think that I like to view different stages of caregiving as like transitions, and think about like what it is that you're going to and what you can gain, what skills that you look forward to bringing with you into your next transition and your next stage, can be helpful to it, and sort of planning in that way.
Sure. Thank you so much. And the next question, the beginning of the question, I think that we have addressed, how do I cope emotionally with the burdens of caregiving when the going gets tough? But the second part of this question, how do I cope with feeling isolated and alone?
Yeah, I mean, caregivers report isolation so much. And I think that this has come up a lot during the pandemic. Everyone's feeling isolated, and we are experiencing that so much. So there are multiple reasons why this could come up in the caregiving sense. One, you may not feel like you can really share with the patient, or you want to protect the patient from certain feelings or experiences like we reflected on earlier. I think that communication can be useful there. I think accessing support, I mean, even just being here today, being this sense of connection that I think we probably all, just knowing that there are others in this room, that there are other caregivers who are offering specific strategies, can be helpful. We can talk, I guess, about like resources. I would suggest looking up like Cancer Care is an organization that has caregiver support groups and things like that. One thing I find tends to be a challenge is like people actually having time for like accessing social support, and that sometimes like you don't really have time to go to lunch with friends or do whatever it was previously that may have made you feel connected, and that suddenly your new normal of caregiving just disconnects you inherently because of the experience. But that's why like maybe accessing other people who are going through a similar experience might be helpful in that sense. Yeah, but I just wanted to say that I think that's a really common experience, and social support is so important. So looking for whatever, however it may show up for you. Even animals can offer support to loved ones.
That's true. And I do want to echo what you're saying, Dr. Mitchell, that you're not alone, and just being on this program with so many other caregivers, and so many caregivers actually submitting questions that are very similar in nature. just to know that you're really not alone, and there are other people that you could reach out to, and we will have resources for you as caregivers. The next question, is there any type of compensation for being a caregiver?
Yeah, so this is tough. Like the short answer isn't ideal, I guess. Unfortunately, the opportunities are fairly limited, and they tend to vary by state and regulated differently in each state. In New York, for example, if your loved one is a Medicaid recipient, there's this consumer directed program that would allow you to be compensated as like at the Medicaid hourly rate. So, you know, that may be helpful for some folks if you like formally register as an official caregiver. There are opportunities through the VA. If your loved one is receiving care through the VA, there are caregiver supports there. But I think I kind of alluded to this at the beginning of my presentation, that I think we see this as sort of a public health problem. And there aren't a ton of options. And our hope is that these sorts of compensation become more broadly available. But I think they're way too limited now. But yes, we'd look into the state specific options. Just definitely, if your loved one's Medicaid recipient, see what might be available to you. And certainly the VA has a lot of resources actually.
Great, thank you. And the next question, how to answer, how are you doing, when you're just trying to get through the day, and how to handle social celebrations when you don't feel like celebrating, but don't really want to be alone either.
Yeah, this comes up a lot. I think that all the patients or what we consider the caregivers, the patients in our clinic, and the caregivers with whom I work often say that how are you doing question is so difficult. Like what the honest answer is not what people are really going to want to hear. So you're not alone with that. And, I want to emphasize that. I think that this comes back to sort of having like your elevator statement. Of course, it may vary depending on who's asking you, but figure out what you're comfortable telling people, and that you don't have to have a perfect answer all the time. And that, and think about like sort of this, what is it that's like, question, what is it that is really driving us to feel a certain way? Like is it to, sort of stick with the sort of societal expectation and standards around how to respond to that thing. So have some flexibility and compassion with yourself, and answer in the way that feels authentic and meaningful to you, and honest. So I think that's quite okay to say that it's not, things are not 100%. I think that second part of that question was about celebrations. And similarly, while I encourage folks to sort of, you may be experiencing as a caregiver, I alluded to this earlier, but caregivers experience anxiety and depression symptoms, and you may be feeling kind of withdrawn. It's difficult to get going. It's difficult to sort of involve yourself in those things. There's two parts of this. Like, take a good look at why that's coming up for you. If it's because you're just feeling low mood, sometimes getting going and going to these things can help. Like once you act into doing it, it might improve your mood a little bit. And I also think it's so important to just recognize it's okay to set that boundary for yourself, and that you might be able to honor someone or celebrate in a different way, and that you're prioritizing your needs and your self-care as going through this really this crisis, and find a way that is most effective for you to respond to those invitations, and feel free to decline if that's what you really need to that might be time that you can use for self-care, for example.
Sure, thank you. And our last question today, there's so many supports for patients. Are there any support services for us caregivers?
Yeah, so I think that is so key. I mean, I'm so glad you're here. And obviously in the Leukemia and Lymphoma Society supports caregivers. So I would also look at resources through the American Cancer Society, the cancer support community. There's the National Alliance for Caregivers. Cancer care, I mentioned before, we refer patients all the time to cancer care, and they have caregiver specific groups nationally that I believe you can access like online. So Cancer Care is a big one there. I also would encourage everyone to just look into the resources that are available at your cancer center. At Memorial, we have our caregivers clinic. Dr. Applebaum runs that, and I've been working in it the past 2 years. And we see many, many caregivers presenting with a range of concerns, and we really work hard to support the caregiver and psychosocial needs here.
Great. Well, thank you so much. A special thank you to you, Dr. Mitchell, for volunteering your time and expertise with us last minute. So we really do appreciate you, and thank you for answering so many questions and letting people know that they're not alone. Now, if you weren't able to get to your question today, or you want more information, you may speak with an LLS information specialist at 1-800-955-4572, and we're open from 9 a.m. to 9 p.m. Eastern Time, or you can reach us at lls.org/contact us. Now, information specialists are available to answer your questions about treatment, including clinical trials, answer other questions you may have about support, financial assistance for treatment. We do speak to many caregivers, and the service is open for caregivers also. We have a caregiver online chat specifically for caregivers that get together once a week to provide each other with that support and information. And you can find out more about that at lls.org/chat. And for more information regarding caregiving, please give us a call or go to our website at lls.org. And we do have a new caregiver workbook, which may be ordered free of charge by contacting an information specialist. Now, webcast participants, please complete the program evaluation at lls.org/caregiver survey. For the professionals on this call, if there are any, please note that there are no continuing education credits for this program. And as a reminder, you can download and print the slides as well as view today's program at lls.org/programs. Again, I'd like to thank Pharmacyclics, an AbbVie company, and Janssen Biotech for support of this program. Again, Dr. Mitchell, thank you for volunteering your time with us today. And on behalf of the Leukemia and Lymphoma Society, thank you all for joining us. Take care. Remember, we're here for you as well as your loved ones. Let us know what you need and let us be there for you. Thank you.